The first sign that this wasn't going to be a normal day came when Orion Feldman accidentally stabbed himself in the hand with a screwdriver. He'd been attempting to adjust the hydraulic tensioner on the left leg of the clunky exosuit, which had been giving out an irritating hum every time he moved. A simple tightening job. But the tool slipped, his grip failed, and the flathead end drove into the soft web between his thumb and index finger with a sickening squelch. A son of a he jerked back, the screwdriver clattering to the grated floor of Workshop C. Bright red blood dripped onto the metal, forming fat splotches that spread like dye in water. Across the room, a shrill, horrified gasp echoed. Zhoril froze mid-step, its translucent blue skin paling to a pale, ghostly hue. Its three-fingered hand snapped to its mouth. Its large, obsidian eyes widened, the ridges of its skull twitching in what Orion had learned was the Varnathi expression of distress. Orion looked up from his bleeding hand. "Zhoril, I'm fine. You are leaking." Zhoril's voice trembled. "Your vital fluid is escaping your body." "Yeah, that's blood." "It happens sometimes." Zhoril's knees buckled, and it clutched the workbench for support. "Why are you not already unconscious?" That is severe trauma." Orion grabbed a rag from the supply shelf, wincing as he wrapped it around his hand. "It's not that bad. Just a puncture. Hurts like a bastard, but I've had worse." Zhoril made a strangled sound, then turned and vomited a shimmering, silvery substance into a nearby waste bin. "Okay," Orion muttered. Note to self: don't bleed in front of Zhoril. The alien remained bent over the bin, trembling, muttering to itself and rippling Varnathi. Orion gave it a moment before speaking again. "Zhoril, hey, wrap it up and continue on. I'm gonna hit the infirmary. You stay here and finish the diagnostic routines on the auxiliary servos." "You are functioning." Zhoril's voice cracked. "I've still got all my fingers." Orion held up his uninjured hand. "Just need a couple stitches, maybe a tetanus booster." "You good?" Zhoril blinked slowly, then nodded in jerky, uncertain movements. Orion left the workshop, cradling his hand in the blood-stained rag. The hallway was mercifully empty, no need to explain himself to the station's more high-strung personnel. At the infirmary, Dr. Helva barely raised an eyebrow as she cleaned and stitched the wound. "You're lucky," she said. "Another centimeter and you'd have torn the tendon." "Lucky's not the word I'd use. You need to stop fixing things like you're on a time bomb." I was supposed to be showing Zhoril how to calibrate a tensioner, not giving a live demo on human anatomy. Helva finished wrapping his hand and muttered, "Well, you made an impression." When Orion returned to Workshop C, Zhoril had nearly finished the diagnostic sequence. The alien glanced up, visibly relieved to see him alive. "The diagnostic revealed a minor misalignment in the right lateral actuator," Zhoril said. "Good work." There was a pause. "You're not dying?" "Nope. Just bandaged." Zhoril hesitated, then asked, "How often do humans leak?" "Depends. Some jobs are more hazardous than others." Zhoril exhaled, a long, fluttering breath. "Our kind do not experience open injury well. Blood is kept entirely within. Always." "Yeah, I gathered that. I thought you were perishing." Zhoril looked at the floor. "It frightened me." Orion softened. "Hey, I get it. I didn't mean to scare you. You said to wrap it up and continue on. It's something we say when things go wrong. Means, deal with it. Keep moving." Zhoril looked at the bandage. "That is how you live." "Pretty much." Zhoril stared at the exosuit. "That is terrifying." Orion chuckled, winced, and flexed his fingers. "You'll get used to it." The next few days were uneventful, unless one counted Zhoril's sudden obsession with human first aid protocols. The alien followed Orion everywhere, recording every bandage, antiseptic spray, and ice pack application with wide-eyed fascination. Orion didn't mind. It was kind of endearing. Then came the reactor coolant leak on Deck 5. Orion was called in with 3 others for emergency containment. Zhoril, desperate to understand human fieldwork, pleaded to come along. Against better judgment, Orion agreed, if only to show Zhoril that not all human work ended in bloodshed. The leak was worse than initial reports. Steam hissed violently from a ruptured seal, and the air smelled like burning metal. Orion donned his safety suit and pointed to the leak's origin. "That seal's gone. We need to cut power to the junction, then clamp it." Zhoril stayed behind the safety line, observing. Orion and his team moved quickly, but as he reached for the clamp assembly, a panel above him collapsed. A jagged metal shard sliced his leg from mid-thigh to knee. He screamed. Blood sprayed across the floor. Zhoril let out an inhuman wail. "Clamp it," one technician shouted. Orion fell to one knee, teeth clenched. "I've got it. Just keep the pressure steady." Zhoril bolted forward, ignoring the safety line. "Stop moving. Your blood." Orion's vision swam. He grabbed a pressure pad from his kit and pressed it hard against the wound. "Zhoril," I said, "wrap it up and continue on. You are dying." "No, I'm bleeding. There's a difference." Zhoril stood frozen, shaking. Orion forced himself to his feet, one hand holding the pad, the other reaching for the clamp. He secured it over the ruptured seal, twisted it shut, and collapsed back against the wall. The hiss of steam ceased. Silence followed. "Seal's holding," someone shouted. "I need evac," Orion gasped. Zhoril dropped beside him, hands flitting uselessly over the bandage. "You are not okay." "Nope." Zhoril stared at him. "Why?" Orion blinked slowly. "Because if I didn't clamp that seal, the whole deck could have gone up. You don't wait for someone else to do it when you're there." Zhoril didn't move until the medics arrived. The cut required over 40 stitches and a week in bed. Zhoril visited daily, always bringing a different question. "Why do you risk so much? What does pain feel like to you? Why do you keep going?" Orion tried to explain, not out of bravado, but because that's what people did. You kept things running. You helped others. When something broke, you fixed it, even if it cost you a chunk of your leg. 2 weeks later, during a training simulation, Zhoril watched a human cadet trip and scrape his elbow. Instead of panicking, Zhoril retrieved a med kit, wrapped the wound with gauze, and said, "You may wrap it up and continue on." The cadet blinked. Thanks." Zhoril turned to Orion, who had been watching from the observation deck, his crutches leaning against the railing. The alien gave a tiny nod. Orion nodded back. The final test came 3 months later during a joint rescue drill in the upper docking bay. An explosion in the simulated wreckage trapped 2 trainees. Zhoril and Orion were first on scene. They crawled through the debris. One trainee had a broken arm, the other a gash across the forehead. Zhoril's gaze flicked to the blood, then to Orion. His hands twitched, but he didn't look away. "What do we do?" Zhoril asked, voice steady. "Wrap it up," Orion said, handing over a pressure bandage. Zhoril knelt beside the injured trainee, applied the bandage with practiced care, and helped lift him to safety. Not once did he vomit. Months passed. The Varnathi exchange program ended. Zhoril returned home, but not before one final visit. "I still do not understand how you endure so much," Zhoril admitted. Orion, sitting on the workshop bench with his legs still stiff after rehab, looked up. "It's not about enduring. It's about choosing to keep going." Zhoril was quiet for a moment. "I have decided to study emergency medicine. For humans." Orion blinked. "Seriously, I will not faint next time." He smiled, the first genuine one Orion had ever seen from him. "Thank you for teaching me how to wrap it up and continue on." Then he was gone. Years later, in a hospital on Earth, a Varnathi surgeon calmly cleaned a human soldier's bleeding shoulder. A nurse whispered, "You okay with the blood?" Zhoril replied, "Yes. I have seen worse." He applied the bandage, then said softly, "You may wrap it up and continue on." The first time Zhoril attempted to suture a wound, it lost 2 pairs of gloves and nearly its lunch. It was 1 week into its residency rotation at the International Trauma Research Unit, an underground facility buried beneath the Icelandic tundra that specialized in cross-species emergency medicine. The human staff, hardy and immune to most surprises after 2 decades of interstellar cooperation, had quickly learned to give Zhoril a wide berth during practicals. Not because it was incompetent, it was fast, meticulous, and memorized every protocol within days, but because it had a tendency to freeze whenever anything pulsed or oozed. Today's patient was a cargo loader technician named Renata who'd lost her footing on a stair gantry and landed shoulder first into a steel conduit. The resulting laceration exposed muscle and left a trail of blood from the docking bay to the triage unit. Zhoril arrived just after the field medics had stabilized her, its elongated frame hunched under the low door frame, carrying a tray of sterilized instruments with both hands. "Renata, this is Zhoril," said Dr. Lin, the attending physician. "It's going to close the wound. I'll supervise." Renata blinked at the alien. "You're the one who fainted during the nosebleed drill, right?" That has been addressed, Zhoril said. Its voice was steady, but the tray rattled faintly. I am prepared. Dr. Lin gestured toward the wound. Irrigate it, then layer the closure. You've got 12 minutes. Start. Zhoril's tendrils twitched as it approached, peeling open the irrigation syringe with trembling fingers. Renata winced as the saline hit the exposed tissue. You okay there? Six Eyes, she asked. I must respectfully request silence, Zhoril said, not looking up. Your epidermal plane has not retracted evenly. I will need to align the facial edge manually. Renata laughed. You're bossy under pressure. Zhoril pinched the wound with forceps and slid the curved needle through with a fluid motion, then pulled the suture taut. It repeated the process, adjusting angles as it progressed, slowly building a ladder of fine knots across the raw tissue. 8 stitches in, Renata's blood oozed around the final entry point. Zhoril's pupils contracted. Its hands paused midair. Dr. Lin leaned closer. Don't stare at it. Finish the stitch. The viscosity is increasing, Zhoril murmured. Capillary action is Zhoril. Close the skin. Zhoril inhaled sharply through its gill slits and forced its hand to move. The final knot tied off with a confident tug. It dropped the needle into the tray and stepped back. Renata examined the line of sutures. Looks good. Zhoril's knees buckled. Dr. Lin caught it by the elbow before it hit the floor. Recovery room's that way, she said dryly. Go sit before you start vibrating. I did not expel my digestive fluids, Zhoril muttered. That's progress. A few hours later, Zhoril sat in the staff lounge staring at a mug of steaming ginger tea it couldn't drink. Orion, now working as a civilian instructor for the trauma unit, slid a chair around and dropped into it backwards. You stitched up a human and didn't collapse. That's a milestone. I trembled. Yeah, but you didn't run. Zhoril tapped its fingers on the table. Why do your kind endure so much body compromise without distress? The injury was severe. Orion shrugged. We compartmentalize. Makes it easier to fix the mess when you're not panicking about it. You spoke of wrapping up and continuing. I understand now it is more than a phrase. It's a survival instinct. Zhoril looked down at the tea. I still do not like the color of blood. Neither do most humans. We just get used to seeing it. Later that evening, Zhoril joined a 3-person response team sent to the glacier outpost when a subrail malfunctioned. A crew member had snapped both femurs when the harness failed. The patient was already sedated when they arrived, but the legs were visibly bent in unnatural directions. The other medics hesitated. Zhoril didn't. It moved in, scanned for internal bleeding, and started prepping an external fixator. The fracture reduction was messy, full of bone-grating sounds and sudden muscle spasms. One of the human medics turned away to gag. Zhoril didn't blink. It aligned the femur ends with cold precision and locked the frame in place. When they returned, Dr. Lin reviewed the footage. You didn't react, she said. I focused on the outcome. You're learning. I still dislike the sounds. Everyone does. Over the next several days, Zhoril rotated through burn care, oxygen deprivation recovery, and a case of decompression sickness that left a lunar miner with cerebral edema. It observed, asked questions, and began suggesting technique adjustments based on Varnathi anatomical principles. Its recommendations were so effective that Dr. Lin approved 3 of them for human use. But the real test came 3 weeks later, when the station's main corridor suffered a catastrophic pressure loss during a cargo transfer. The sudden decompression shattered a viewing panel and hurled 3 personnel into the bulkhead. Zhoril happened to be passing through on its way to the infirmary. The corridor was chaos. Alarms blared, and the emergency shutters slammed down. One human was conscious, pinned under a collapsed crate. Another was unconscious and bleeding from the temple. The third was breathing erratically, with one leg twisted under her body. Zhoril didn't wait for backup. It dropped to its knees beside the unconscious one, checked the carotid pulse, and began assessing for cranial trauma. Blood welled along the scalp. It tore open its emergency kit, applied a pressure bandage, then moved on. The pinned man groaned, his leg crushed beneath twisted metal. Zhoril wedged a beam under the crate and used its entire body weight to lever it just high enough to slide a support under. The man coughed, then passed out. One by one, it stabilized all 3, securing airways, immobilizing spines, and splinting the broken leg with a thermal brace until help arrived. Orion reached the scene 6 minutes later. You were alone? He asked, eyes scanning the wounded. I was nearest. You triaged 3 people without assistance. I followed protocol. You used your own body to lift a crate. It was the fastest method available. Orion looked at the blood smeared across Zhoril's arms. You didn't even glove up. Zhoril stared at the mess. There was no time. Orion exhaled, crouched beside the crate, and gave Zhoril a long look. You've changed. I adapted. You didn't just wrap it up. You ran the whole show. Later that night, Zhoril stood alone in the observation dome, watching the auroras flicker across the sky. The station's lights reflected faintly off the glass, casting long shadows behind it. Dr. Lin entered quietly. You did good today. I was frightened. You didn't show it. I thought one of them would perish. They didn't. Zhoril tilted its head upward. When I arrived here, I could not comprehend your tolerance for pain. And now, I do not wish to experience it. But I understand why you face it. Dr. Lin leaned against the railing. Pain isn't the enemy. It's the message. You just learn how to read it without letting it stop you. Zhoril's fingers tapped the rail. I have begun dreaming of injuries. That's normal. They are not unpleasant dreams. They are instructional. Your brain's processing. It's how we all learn. I am not human. No, Dr. Lin said. But today, you were something else. You were the reason 3 people are still breathing. Zhoril didn't speak after that. It just stood there, watching the lights move across the sky until the auroras faded and the dome lights dimmed to night mode. The Varnathi delegation arrived at the Reykjavik shuttleport under sleet, fog, and the kind of wind that seemed to mock architectural integrity. Zhoril stepped off the transport last, clutching a slim case with its credentials, a single-use translator chip, and a folded photograph of the trauma unit's human staff mid-laughter, taken without their knowledge. The image was not necessary to its duties, but it had become a focusing object, a reminder. Inside the terminal, a human officer scanned its ID band and gestured toward the security corridor. Your contact's delayed. Head through processing. You'll be met on the other side. Zhoril nodded once and proceeded into the checkpoint, where the inspection drone hovered uncertainly before requesting it to remove its outer wrap. The garment was already soaked and clung unpleasantly to its dorsal ridges, but it peeled it off without complaint and entered the scanner. The interior of the terminal was loud, bright, and filled with unfamiliar dialects. Zhoril found a bench near the emergency defibrillator station and sat with its case balanced on its knees. The case vibrated faintly. It was a reminder that the skin patch inside, adapted from Varnathi clotting gel, had a shelf life of 96 hours once activated. Zhoril had plans to donate it for cross-species testing. A young human in a food service uniform approached timidly, holding a napkin-wrapped bundle. Are you the medical guest from Varnath? Zhoril blinked once. I am Zhoril. Yes. They said you haven't eaten. This is a sandwich. It's warm. Zhoril accepted it with both hands and inspected the contents. It contains animal protein, turkey, and something called aioli. Zhoril gave a polite nod and placed it beside the case. The human lingered. Sorry, but are those markings on your neck natural? They are thermoregulatory seams. Whoa, like gills. Not for respiration. Still cool. The human left, beaming. Zhoril found the interaction oddly calming. It removed the sandwich's wrapping and sniffed cautiously. Unfamiliar scents. It took a small bite. The aioli was overly acidic, but tolerable. 40 minutes later, a woman in gray coveralls arrived, her boots squeaking on the wet floor. She wore a med-evac badge and looked tired in the way humans often did when they hadn't slept in more than one circadian cycle. You must be Zhoril. I'm Mara. They didn't tell me you were this tall. My vertical axis is fixed. Right? Grab your things. We've got a situation. They need us at Frigeri Station. Now, Zhoril followed her outside, where a narrow emergency vehicle idled. Inside, the heat was turned too high, and Mara drove with one hand while pulling on gloves with the other. Collapsed geothermal shaft, she said. 2 techs went down, one's hurt bad, the other's not responding. Local medics can't get in deep enough. Zhoril strapped in. Ambient conditions? Hot. Steam pockets. Some exposed metal. You'll be lucky if your suit doesn't melt. Will there be blood? Mara turned to glance at it. Probably. Still a problem? Zhoril adjusted the pressure seals on its gloves. No, they arrived 23 minutes later. The shaft was a jagged hole in the rock, with a lift cable extending downward into the steam like a fishing line cast into fog. One worker in a fire-retardant suit greeted them. "We sent down a drone. The injured one's got a compound fracture. Right femur. Looks like it tore through the suit. The other's unconscious. Might be heat stroke." Zhoril stepped to the edge and peered down. Descent time, 3 minutes. Stable platforms 10 meters above them. "I will need a thermal hood and a second pack." Mara raised an eyebrow. "You're going down solo? You are not suited to this heat." "I am acclimated to higher ambient temperatures." Mara didn't argue. She helped Zhoril into a reinforced harness and handed over a collapsible stretcher. "If you pass out down there, I can't reach you. I will remain conscious." The descent was disorienting. Steam hissed on all sides, and the walls glistened. The platform jolted halfway down but resumed its path without further incident. At the bottom, Zhoril stepped off and tested the ground. Solid. Heat radiated through the soles of its boots. The injured technician was conscious but pale. His leg was bent horribly, and his suit leg was soaked dark. The other lay sprawled nearby, breathing shallowly. Zhoril knelt and ran a scan. Fractured femur, massive blood loss, but no arterial spray. Good. It unsealed its case and retrieved the Varnathi gel patch. The technician flinched as Zhoril tore open the pant leg and wiped the area clean. "This will sting," it said, and applied the patch. The gel foamed, sealing around the wound and forming a flexible crust. The bleeding slowed within seconds. The unconscious tech moaned suddenly and rolled. Zhoril caught his shoulder and checked his pupils. Unequal dilation. Cranial trauma. It unpacked a stabilizer collar and fitted it around the human's neck. Zhoril to surface. It said into the mic, "Prepare for dual lift." Both patients are secured. Back on the surface, medics swarmed the lift as soon as it rose from the steam. Zhoril helped maneuver the stretcher onto a gurney before stepping back. Its suit hissed with residual heat. Mara tossed it a towel. "You're sweating." "I do not sweat. I am venting." "Same difference." "You saved both." Zhoril removed the thermal hood and shook out its tendrils. "The gel patch must be cataloged. It is effective. Consider it done." They rode back in silence. Zhoril stared out the window at the shifting clouds, then finally asked, "Why do you continue risking your lives in unstable environments?" Mara drummed her fingers on the steering wheel. "Because someone has to. If we didn't go in, they'd die. They're not your kin. They're people. That's close enough." Later that evening, Zhoril returned to the trauma unit's lab and logged the results of the patch trial. It submitted the data to the cross-species treatment board, then sat quietly at its desk, watching the monitor scroll. Orion passed behind it carrying a tray of surgical tools. "You look like you just survived a volcano. There was no eruption. Still, you handled it." "I did not hesitate." "That's new." Zhoril looked up. "I understand now. It is not the absence of fear that matters. It is the act of continuing despite it." Orion smiled. "Now you're starting to sound human. I will not mimic your species." "Good. We've got enough problems." Zhoril stood. "I will shower." "Please do." Before leaving, Zhoril opened a drawer and placed the unused half of the sandwich inside a sealed container. It would not eat it, but it had learned that humans often preserved objects of significance. It understood now. Not everything needed to be consumed. Some things were kept simply to remember that they had been survived. Outside, the wind howled again, but Zhoril had already begun the walk to the showers, one hand steady on the rail.